Hey everyone, and this is Daily Dose of Medicine. Today we will talk about hyperhidrosis. This refers to a medical condition characterized by excessive sweating that goes beyond the body's normal physiological needs for temperature regulation. While sweating is a natural response to heat or stress, individuals with hyperhidrosis experience sweating that is more pronounced and occurs even when conditions don't warrant it. There are two main types we will talk about. The first one is primary focal hyperhidrosis. This is the most common and typically begins during childhood or adolescence. It's not caused by another medical condition and tends to affect specific areas such as the palms of the hands, soles of the feet, face, and underarms. Secondary generalized hyperhidrosis is the second type. This type is less common and is usually a result of an underlying medical condition or a side effect of medication. It can cause sweating all over the body and often begins in adulthood. The exact cause of primary focal hyperhidrosis is not well understood, but is thought to involve overactivity of sweat glands. Secondary can be caused by a variety of medical conditions, including metabolic disorders, neurological disorders, infections, or hormonal imbalances. The main symptom is excessive sweating, obviously, which can significantly impact daily activities and quality of life. People with this condition may find it challenging to shake hands, hold a pen, or use electronic devices due to sweaty palms. It can also lead to emotional and social issues. Treatment options depend on the severity of the symptoms and the type of hyperhidrosis. They may include antiperspirants, over-the-counter or prescription strength antiperspirants can be applied to the affected areas. Medications such as anticholinergics can help reduce sweating. Botox injections of botulinum toxin type A, can temporarily block nerve signals responsible for sweating. Iontophoresis. This involves passing a mild electrical current through water to the skin's surface to reduce sweating. Surgery in severe cases. Surgical procedures like sympathectomy may be considered to interrupt nerve signals that trigger excessive sweating. But please, if you suspect you have hyperhidrosis, it's essential to consult with a healthcare professional who can provide an accurate diagnosis and recommend an appropriate treatment plan. Thank you for watching. Do not forget to watch our skin related videos, which I'll be sharing on the screen, and see you on the next video.